6 foods to avoid if you have an enlarged prostate. Enlarged prostate, also known as benign prostatic hyperplasia, BPH, is a common condition that affects most men, especially if you are over 50 years old. As we get older, the prostate gland, which produces some of the sperm, begins to enlarge. This positive enlargement results in a variety of urinary symptoms, such as difficulty starting to urinate, an urgent need to urinate, and weak or interrupted urination. The prostate is located just below the bladder and surrounds the urethra, the tube through which urine leaves the body. When the prostate enlarges, it puts pressure on the urethra and blocks the flow of urine, causing many problems. These symptoms can significantly affect daily life, sleep disturbances due to nighttime urination, increased stress, and reduced quality of life. In severe cases, the inability to completely fill the stomach can lead to urinary incontinence and bladder damage. The exact cause of prostate enlargement is not fully understood, but it is thought to be related to hormonal changes, especially an imbalance between testosterone and estrogen. As men age, testosterone levels decrease and estrogen levels increase, contributing to prostate growth. In addition, lifestyle factors, including diet, exercise, and general health, can influence the development of BPH. Although this disease is benign, it is important to manage and reduce its symptoms in order to live a healthy life. In this video, we look at 6 specific foods that can irritate the prostate and worsen urinary symptoms. By knowing what foods to avoid, you can make food choices that support prostate health and overall well-being. We explore lifestyle changes and natural remedies that can manage and possibly reduce prostate size. Please note that this video is for educational purposes, and it is important to talk to your healthcare professional about personal health advice and treatment options. So, what's going on here? As you can see in this picture, the prostate is a small gland located just below the bladder, the organ that holds your urine. Your urine passes through a tube called the urethra. When the prostate begins to grow, swell, or enlarge, it puts pressure on this tube that connects to the urethra. This is where the problems begin, as your urine cannot pass through the tube properly due to swelling. As a result, fluid backs up and gets trapped in your bladder. Symptoms of an enlarged prostate can be difficult to control the bladder, especially at night when you are trying to sleep. You have an urgent need to urinate. Sometimes only a small amount of urine comes out. Urinary flow may be weak and may stop and start urinating. On the other hand, you may have to strain or push to get the urine to flow in the first place. Studies show that an enlarged prostate is caused by a hormonal imbalance that causes anabolic hormones, such as estrogen, insulin, or DHT, to accumulate in the body. Unfortunately, some foods can stimulate these hormones, causing swelling and enlargement of the prostate, increasing the risk of prostatitis, infections, and prostate cancer. In today's video, I want to share with you 6 good foods to avoid if you have an enlarged prostate. You'll also learn about some simple lifestyle changes and treatments that can shrink the prostate and improve urine flow. A quick reminder: this video is for educational purposes only, so talk to your doctor if you have any health concerns on dairy. If you have an enlarged prostate that causes urinary problems, it is important to eliminate dairy products such as butter, cheese, milk, and cream from your diet. Dairy products are made from cows' or goats' milk and contain natural growth hormones, prolactin and IGF-1, that help lactating animals grow. These hormones can stimulate prostate enlargement and swelling of the gland and pressure on the urethra and bladder. If you don't have prostate disease, dairy products are nutritious and healthy. However, if you have prostatic hyperplasia, BPH, try eliminating dairy from your diet for 1 to 2 weeks and see if your symptoms improve too. Vegetable oils, seed oils, cooking oils are mainly made from GMO grains such as soy, corn, cotton, canola, grapeseed, and soybeans. Rice. Contrary to the name, these oils are not derived from vegetables. Vegetable oils are used in fast foods, prepared foods, fried foods, store-bought salad dressings, margarine, and coffee creamers. These oils are high in omega-6 fatty acids that can cause severe inflammation in the prostate gland and liver. Your liver plays an important role in balancing hormones and filtering out excess chemicals. When these oils are harmful, hormones such as estrogen and insulin are produced in the body, causing the prostate to enlarge and the walls of the uterus to weaken. Remove these from your diet and make your own healthy meals at home with extra virgin olive oil, cold-pressed avocado oil, and raw coconut oil. I also recommend eating more foods rich in omega-3 fatty acids, such as fatty fish, salmon, sardines, and dairy products. These are anti-inflammatory and prevent damage due to high consumption of omega-6 oils. 3. Sugar and starch. When you eat refined sugar, flour, wheat, or starch, the body quickly converts it into blood sugar, glucose. This can damage your cells quickly, especially if you eat too much sugar in one meal. To prevent damage, your body secretes insulin, a hormone that helps take sugar from the blood and move it into the cells for energy. But if you continue to eat refined sugar and foods that convert to sugar, the pancreas produces more insulin. High levels of insulin is a growth hormone, and high levels can cause the prostate to enlarge rapidly. Too much sugar in the kidneys causes increased urination, especially at night. Start reducing sugar and carbohydrate intake from juice, cake, cookies, cakes, bread, soft drinks, butter, and flour. Stop eating after 7 p.m. and let your blood sugar stabilize. You will soon find that you need to urinate less and sleep better at night. 4. Non-fermented soy, such as soy protein isolates, soy powder, can be found in soups, ready meals, vegan meats, goodbye, powdered milk. It is added for children and processed food. Excluding soy protein increases insulin levels in the body, making BPH and urinary problems worse. Soybean powder increases the levels of estrogen, which contributes to the enlargement of the prostate. In addition, soy is GMO and grown with chemical pesticides, herbicides, and insecticides that are endocrine disruptors. Soy is also high in phytic acid, a substance that inhibits the body's ability to absorb essential minerals such as zinc, which is important for prostate function. If you have prostate problems, eliminate all unfermented dairy products. Fermented soy foods such as miso, soy sauce, tempeh, tofu, and natto are good because the fermentation process helps remove the negative effects of soy and makes them better. Health for the body. 5. Alcohol acts as a solvent that destroys liver cells, hepatocytes, and causes hormonal changes in the body, such as increased estrogen and insulin. High levels of these anabolic hormones cause the prostate to enlarge and increase blood pressure, weakening muscles and tendons. Limit alcohol, especially beer, which is highly estrogenic. Drink 1 to 2 cups of kombucha tea in the evening. This fermented drink supports gut microbes, helps eliminate toxins, and increase liver production, keeping your liver clean and balancing hormones. 6. Processed meat includes foods such as salami, sausage, canned, and pepperoni. This meat is processed and mixed with chemicals, nitrates, dextrose, sugar, soy protein, and vegetable oil. Studies show that the risk of cancer increases due to oxidative damage to cells and the formation of ages that clog arteries and cause blood clots. Processed meat can also damage your liver, increasing the risk of prostate cancer and worsening prostate problems. Cut out processed and conventional meat and start eating higher quality meat from local farms. Make sure to eat grass-fed and organic food to avoid the hormones and pesticides fed to the animals. Beef and grass-fed livers are packed with zinc, heme, iron, and protein, which support a healthy prostate and help with sperm production. Remember that each person has a unique body and biochemistry, so it is important to eliminate foods from your diet through trial and error to see if your urinary or prostate problems improve. Or later in this video, I will tell you 6 lifestyle changes and treatments you can use to shrink your prostate to its original size. Other causes of prostate enlargement. Before you talk about how to shrink an enlarged prostate, let's look at some common issues. The main reason is that eating too much refined food such as sugar, processed grains, and flour depletes zinc stores and increases insulin or estrogen levels. Being overweight can cause an enlarged prostate because fat produces more estrogen and insulin, a hormone that causes the gland to grow. As we age, stomach acid weakens, and our ability to absorb zinc and other nutrients necessary for a healthy prostate decreases. Liver damage may make you more prone to hormonal imbalances, as the liver helps filter excess hormones. Non-organic foods contain less pesticides and chemicals that damage the liver, causing hormonal imbalance and enlarged prostate. Finally, dairy products and processed foods can exacerbate prostate problems due to growth hormones and hormonal problems. How to shrink an enlarged prostate. 1. Start eating pumpkin seeds. Add a small handful of pumpkin seeds every day. These are effective in reducing prostate size due to their zinc content, phytosterols, and vitamin E, which work together to balance hormones. 2. Consider nettle root. If you have urinary problems, take 120 milligrams of nettle root 3 times a day. This plant helps to reduce inflammation in the prostate and prevent the accumulation of DHT and estrogen 3. Reduced problem foods, especially dairy products, sugar, vegetable oils, and processed foods, which contribute to hormonal changes and inflammation of the prostate. 4. Eat cruciferous vegetables. Eat a daily salad with organic cruciferous vegetables such as radishes, broccoli, arugula, kale, collard greens, or cabbage. These include sulforaphane and indolylmethane, DIM, which help your liver filter out excess hormones that cause prostate growth. 5. Engage in high-interval training. Height. Just 10 minutes of HIIT twice a week can improve testosterone levels and reduce other anabolic hormones, such as DHT, estrogen, and insulin. Exercise also helps burn excess blood sugar and reduce prostate inflammation. 6. Beware of obesity and alcohol. Eat. If you are overweight, especially in the abdomen, or you drink alcohol every day, you will have a fatty liver. Follow an intermittent fasting program where you eat all of your daily calories in a 4-hour window and fast for the remaining 20 hours. Fasting helps shrink the prostate and remove liver fat. Top 6 vitamins to reduce an enlarged prostate. As we discussed today, managing an enlarged prostate is not only about avoiding certain foods, but also about effective nutrients to support in prostate health. Vitamins and minerals play an important role in maintaining prostate function and reducing symptoms associated with benign prostatic hyperplasia, BPH. In the following video, we look at the top 6 vitamins that have been shown to support prostate health and possibly reduce prostate size. These vitamins are important for regulating hormone levels, reducing inflammation, and promoting overall prostate health. You will learn about the unique benefits of each vitamin, how they contribute to prostate health, and good food sources to include in your daily routine. Whether it's vitamin D for its role in regulating hormones and supporting the immune system, vitamin E for its antioxidant properties, or vitamin B6 for reducing inflammation, knowing these nutrients can help you choosing your health. We'll also discuss how these vitamins can be combined with dietary and lifestyle changes for optimal results. In addition, you will receive advice on nutritional supplements and how you can incorporate these vitamins into your diet through natural food sources. Now, by pressing the video link on the screen, you can access detailed information and practical tips on how to incorporate these essential vitamins into your life. This can be a game changer when it comes to managing and improving your prostate health. Remember that maintaining a healthy prostate is not just about getting rid of symptoms. It's about prevention and protection. The right combination of nutrients, along with a balanced diet and healthy lifestyle, can make a big difference to your overall health. If you found today's news interesting, support this video, subscribe to our channel, and turn on notifications to stay up to date with the latest health and nutrition news. Your support helps us deliver useful information and resources. Thanks for watching. I look forward to seeing you in the next video discussing how specific vitamins can shrink the prostate and increase health.